Okay, so following the handoff from Nurse Elizabeth, I have checked the patient's MAR and chart and determined that there are no contraindications or adverse effects of his medications I need to be concerned about. I've also determined whether or not he needs pre-assessments prior to administering his medications. And then I went to the Pyxis machine and scanned his medications. I got him out there and set him up in his room. I know you're not supposed to set him up in his room, but just for the sake of this video, they're already there. I've also performed hand hygiene, and now I'm about to go and greet my patient, Mr. Knight. Good morning, Mr. Knight. You have medications scheduled to be administered this morning. I'm your nurse, Nurse Gabby, and I'm going to need 2 patient identifiers to administer your medication. So I'm going to need your name and date of birth, please.
Right. My name is Marian, and I was born 12/27/97.
Thank you. I also see you have a visitor today. So, to begin, you have an IV scheduled to be started, and to prepare that, first we're going to do the math. So he's scheduled for 75 milliliters an hour, and we have 1,000 milliliters, and we're going to multiply that by the drip rate, and we're going to say that's 30. So he has about 135 drops an hour. So to get this set up, this will be in a bag, and I would have ripped that bag open and laid it down here. And you did this in several ways, but the way you showed us, you had us hang it up here first, and then I'm going to grab my tubing, and I'm going to prime my IV. So first, I'm going to clamp my IV line. Make sure none of this moves. And I'm going to pull open this tab here. And there will be a cap on this that I would also take off. And this is sterile, so I'm not touching any of what I have here. And I would slide this carefully into the thing and squeeze that to make sure that my dropper is a little more than halfway filled. Now we've already seen some air go up into the bag. It's okay, guys. And now we're going to unclamp the line a little at a time to get the air out and to make sure that we have our drip rate to where it's supposed to be. So you can see it's running. Okay, now that would be hooked up to my patient. And now Mr. Knight are scheduled to receive an IV piggyback of Kefsol, which is an antibiotic. So I'm going to explain that to him. Mr. Knight, you are scheduled to receive an IV piggyback solution of Kefsol, and it is an antibiotic used to treat your pneumonia. So we're going to go ahead and give that to you. Okay. So before we begin, I'll do the math. So what we have, so 500 milligrams of Kefsol over what is ordered, so 500 milligrams times the drop rate, which is 20, and he's supposed to receive 20 drops in a minute or 5 drops every 15 seconds, and this is supposed to run for about 30 minutes. So we are going to first get our hanger, and we are going to move our bag from here, and we're also going to clamp it, which it is already. And I'm going to open my new line. That's just a hanger. We don't really need that. I'm going to go over here and hang that. I'm going to remove this without touching the inner thing, and I'm going to carefully remove the cap. I'm going to slide this in, and I'm getting fluid. This would have been clamped to prevent flow, and we want this about halfway. And this is going to be hooked up to this after I prime the line. Now, I was going to get my alcohol pad and be careful not to touch any of this. I am going to wipe this down thoroughly and attach and twist, and that should be hooked up to my patient, and we could move this back up here. now that his IV is set up, we'll go on to his other medications. Mr. Knight is to receive, by order, 1,500 units of heparin. Mr. Knight, do you know what heparin is used for and why you're receiving this medication?
No.
Okay, heparin is a blood thinner, and we use it to prevent DVT or a blood clot forming in your legs, so it won't go up into your lungs and cause further damage. So we're going to go ahead and give that to you. Is that all right?
Yeah.
Before I start anything, I'm going to check and make sure that this is heparin and that I have the right vial, and I'm going to set that over my vial. I'm going to do the math. So what's ordered, which is 1,500 units over 1,000 units. And he's supposed to receive 1.5 units, sorry, my bad. 1.5 units, and we're going to first begin by drawing 1.5 units of air. I'm going to take off my alcohol pad and inject my air into the heparin. And I'm going to go ahead and flip this and draw 1.5 units and make sure there's no air bubbles. Now I'm going to go ahead and give this to Mr. Knight. I'm going to recap, and this has been ordered to give to him subcutaneously, so I'm going to give it about 2 inches away from the umbilicus into his stomach. Mr. Knight, we're ready to give you your heparin. So as you can see, we're going to go about 2 inches away from the umbilicus. I'm going to take off the cap to the needle. This has no needle on it. And I'm going to inject his heparin at a 45-degree angle. How did that feel, Mr. Knight?
That was fine.
Okay. And I would put this in an appropriate straps container. Next, Mr. Knight is going to receive his vitamin B12, and he's supposed to receive 1,000 micrograms of vitamin B12. So I'm going to explain to Mr. Knight about that medication. Mr. Knight, you are scheduled here to receive 1,000 micrograms of vitamin B12 intramuscularly, so within the arm, and that is probably due to lack of vitamin B12 due to your anemia. Is that okay if we give that to you this morning? Okay. And are you aware of what this is used for and why we are giving this to you?
No.
Okay, we're giving this to you because you have a lack of vitamin B12 due to your anemia. Okay, so I grabbed the appropriate syringe, and before we begin, we'll grab an alcohol prep pad. And place it over the bottle, and we'll do the math. So we have 1,000 microunits. Over 1,000 micrograms. I say units. So he is scheduled to get 1 milliliter of vitamin B12. So we draw 1 milliliter of air into the syringe, move the alcohol pad, and inject our air. Then we flip this and draw up and make sure there's no air bubbles, like that. And with an alcohol pad, I'm going to swab the area on his arm and inject vitamin B12 intramuscular. This has no needle on it. Okay, how does that feel, Mr. Knight?
It feels fine.
Okay. And obviously I would have scanned these medications before delivering it to him. Next, he's about to receive about 100 milligrams of atenolol. And I'm going to get some gloves to put on before I touch his medication. So I scanned the atenolol and asked Mr. Knight, Mr. Knight, you are scheduled to receive 100 milligrams of atenolol. Do you know what we are giving this to you for?
No.
Okay, we are giving this to you for your hypertension. Is it okay if we administer this to you tonight? I mean, this morning?
Yeah.
Okay. So I'll open the atenolol. Mr. Knight, you're also scheduled to receive 650 milligrams of acetaminophen. And since your temperature is over 101 this morning, we're going to go ahead and administer it to you. Do you know what the acetaminophen is for? The acetaminophen is for your pneumonia, and it's an antibiotic. So we're going to administer that to you this morning. Is that all right?
That's fine.
Now these come in 325 milligram packets, and so that's why I'm giving him 2 to give him the full 650 milligrams. And I will scan those medications as well. Mr. Knight, we're going to go ahead and raise the head of the bed to 45 degrees so you can take your medications. Would you like to take your medications with some water?
No, I'm fine.
Okay, well, we're probably going to give you a little bit of water just so you can take that medication. So here you are. Thank you. Did it go down okay? Did you take all of your medications?
Yeah.
Okay. So, we are done administering your medications for this morning, and we're about to come and get you breakfast. Did you have anything in mind for breakfast?
Whatever you guys have, it's fine.
Okay. So we're going to be back in an hour. Let us know if you need anything. Your call light is at the side of your bed, and if you have any complaints or any pain or feeling just worse than you already feel, you can use your call light. I'm also going to check your IV real quick to make sure the sight's all right, and seems everything is okay. So I'll go and I'll be back in an hour. Thank you.